Hello everyone, I'm Dr. Hardik Ganatra, and in this video I'll be explaining the procedure of a Brazilian buttock lift. A Brazilian butt lift, or a BBL for short, is done for women or men who want more volume in their buttocks. This could either be because they've lost a lot of volume due to weight loss, or just a personal desire to have fuller, perkier buttocks. Simply put, a BBL involves transferring the fat from the areas that bother the patient and shifting this fat to the buttocks. The commonest area for taking out the fat for a BBL in my practice is the torso, that is the abdomen and the back. This procedure serves two purposes. It helps to remove the fat from the stubborn areas and fill the areas where there is a deficit. A BBL can be done both for men and women. Yes, you heard it right, it's also done for men. For women, we aim to achieve a perky round butt with a nice curve on the sides. For this reason, we inject the fat in the buttocks as well as in the hips. This is done through a small incision right above the butt cleft and an incision below the butt cheek. My male patients prefer to have more volume in the buttocks without adding any volume to the hips to preserve a masculine shape. The procedure takes anywhere between 2.5 to 3 hours and is done under general anesthesia in a hospital. We keep the patients for one night after the procedure to ensure their safety. Lymphatic massages are started for liposuction areas as soon as day 2 after the surgery. We advise the patients not to lay on the fat-crafted areas for 1 month. Patients usually sleep on their tummy, and while sitting they use a BBL pillow which avoids any pressure on the buttocks. I strictly prohibit the patients from laying down on their sides to avoid asymmetry in the hips. A pressure garment is worn by the patient for about 6 weeks to 2 months. Patients feel swollen for about 2 weeks, following which the swelling slowly starts to subside. A good result takes about 2 months, and the final result takes about 6 months to show. Bruising goes in about 2 weeks after the surgery. You can expect to be working and driving and getting back to your routine life in about 1 week after the surgery. Weight training can be started in about 1 month after the surgery, and cardio can be resumed after 3 months. Remember, only 40 to 50% of the transferred fat survives. The rest gets absorbed by your body. This is the reason why we over-inject, and you might feel that your butts look huge after the surgery. However, they settle down within a month's time. The final result of a BBL is seen by 3 months. For patients who crave more volume, a round 2 of BBL can be done, in which fat can be taken from non-operated areas and injected in the butts and the hips again. For my skinny patients who do not have a lot of fat, we take out fat from multiple areas of the body like the torso, arms, thighs, and we inject this fat to give a beautiful result. This is called a skinny BBL. Remember, BBLs are safe when done by a qualified professional in a safe setting like a hospital, in patients with no major medical concerns. Complications like fat embolism and deaths that you might be scared of have been reported after injection in the wrong plane. Remember, fat is injected above the muscle, never in or under the muscle. This can be done either manually by a skillful and experienced surgeon, or by using an ultrasound during the surgery to guide the plane of the injection. Hope this helps. Like, share and subscribe for more such valuable content.